There's a lot of misinformation floating around right now about gender-affirming care. Today, let's spend some time correcting some of the worst stuff out there.
What is your profession?
Absolutely. I have a Bachelor's of Arts in Cultural Anthropology from UMSL. I have a Master's of Science in Clinical Research Management from Washington University.
Wait, so she's not a doctor? Like, she's not like an MD?
I don't mean to be obnoxious, but I have a PhD in public health, and so I do feel I am probably a bit more qualified to interpret the research than she is. Jamie Reed was not involved in any of the medical care decisions. She was a patient coordinator. She did not provide medical care. She did not advise the medical care.
And I am the executive director of the LGBT Courage Coalition, which is an international organization that is made up of lesbian, gay, bisexual, and adult transgender individuals who adamantly do not support the medicalization of trans kids.
Okay, gender-affirming care is evidence-based. It's supported by like literally every major medical association. The same people who make decisions about like what treatments we should receive if we have cancer, the same people who are making recommendations about what treatment we should receive if we need gender-affirming care. So that's kind of a lie, but okay.
I would actually hope that some therapists would deny additional affirmative care therapy if all that means is a child comes in and says that they're trans and the therapist says, yep, you're trans.
That is not what happens. Therapists don't just say, yep, you are trans. It is multiple consultations where you go through multiple conversations about like, what does that mean? What does that look like? What do you want that to look like? This is implying that a kid walks into a clinic, says I'm trans, they're instantly given medication and sent away. And that is not what happens. There are multiple consultations with the family to even decide what is the best care and whether that is puberty blockers or hormones or neither.
And it is time for the Democrats to stop making this a political issue and start doing the right thing on behalf of Missouri kids.
The Democrats are not making this a political issue. The Republicans are making this a political issue by introducing over 400 bills this year, over 500 bills last year that targeted transgender youth and adults, and most of the times transgender, gender-affirming care for youth.
The only places where anti-trans laws banning like gender-affirming care, forced outing in school, like all of the things that essentially make it less safe for like trans kids to exist in school are happening in places like where Republicans and conservatives are primarily in control. Like this is an issue that is being pushed by the far right now.
I am also in support of a number of the bills being heard in this committee, including the creation of a Parents' Bill of Rights.
It is really rich to hear them use the language of parents first and parents' rights when what these bills would do is deny parents the right to, in consultation with their child and their providers, provide best practices, safe, effective medical care. So it's parents' rights except when it's to give them what is best for their child and what their doctors say is best for their child. But sure, okay.
The information that was handed over regarding patient records, redacted or not, were those the same families that you're saying came to you and said, I have a problem with this?
A number of them were, yes.
But not all of them.
There's a possibility that she like actually violated like HIPAA policies because she like handed documents over about like someone's health to like the Attorney General. That's wild. I feel like this person has no business like being this like forefront like on the like if they saw something and they reported it like then maybe we could have a conversation, but like go back to your bone marrow research. Like what are you doing? Like you're not like a gender affirming care expert.
They are bringing out her and the same discredited doctors and anti-trans, detrans activists because there isn't the popular movement that they want to see.
She's not an MD, so I don't know why she's here. Anyway, that was my last thought.